Accidents and injuries happen to all of us. When they do, it's important to know whether or not to seek emergency medical care or not. Hi, I'm Dr. Bill Fisher, ER physician here locally at Elite Care 24-hour emergency center in League City. The decision to make a trip to the ER is sometimes difficult, and to assist you, we put together some examples of frequent injuries and how they should be taken care of. Some of the most common trauma seen in the emergency department include injuries to the ankle, foot, hand, and wrist, knee, back, head, and neck, injuries sustained in motor vehicle accidents, lacerations, burns, and injuries while pregnant. Though not every case of an injury listed above requires a trip to the ER, there are some signs and symptoms for each that mean emergency department care should be obtained. Injuries to the ankle and foot are common, but if you have persistent pain, can't walk on your ankle or your foot, or there's significant swelling, an X-ray is the only way to tell whether or not you have a fracture or a sprain. The same thing occurs with injuries to the hand and wrist. Persistent pain and swelling probably needs an ER evaluation. Injuries to the knee are more subtle, but swelling, clicking, popping, or pain when you bear weight are an indication to be evaluated. Back injuries are very common. Not all need emergency department care, but if you have terrible pain, cannot walk, lose control of your bowels or bladder, or have numbness in one leg, that's an absolute indication to come to the emergency department. Head and neck injuries, whether seen in children or adults, are common. If you lost consciousness from a head injury, you need to be seen in the emergency department. If you had significant mechanism of injury, such as in a car wreck, and your neck is hurting, that needs to be evaluated too. Whether a laceration needs sutures or not is always difficult. It's a judgment call, and there are other means of closing wounds besides sutures, such as staples or glue. But the best thing to do is come on in and let us look at it. If you don't need stitches, we'll put a Band-Aid on it and send you home. Pregnant women need to be evaluated if they're injured, especially if they are more than 20 weeks gestation. Sometimes these people need to be evaluated more extensively in the hospital, but that's something we need to see them for. Of course, this is a short list and a very quick overview. If you have any questions about an injury, just call us and we'll try and answer those questions. I hope you don't need our services, but if you do, you can be assured that our team of nurses and board-certified ER doctors are here 24/7 to take care of you quickly and efficiently.